Today we live in a world that's full of controversial issues, constantly changing legislation, and a vast array of scientific and medical research and advancements. Keeping that in mind, I'd like you to consider if you or someone you care about were to become ill. Not just talking about a simple cold, but seriously ill that maybe has debilitating or crippling chronic pain, like with MS, or something that causes you to get sick a lot, with chemotherapy. The side effects from that causes people to throw up for a couple of days. One of the great things that we have, though, is that there's usually a numerous amount of options to treat particular conditions and diseases. And we as patients get to choose our treatment. No one can force a particular treatment on us. It is our right to decide how and what we take. Many people also seek second opinions because they don't believe or agree with the doctor's diagnosis or treatment plan. And there's also been a growing amount of alternative and holistic products and services that people are turning to in lieu of traditional treatment options. An article on the Life Science website states that there is an ample amount of evidence to support that there are medically beneficial compounds found in marijuana plants. We as patients, we should have the access to any and all treatment options, including marijuana, since it has been shown in research to have beneficial medical value. The problem is that there is a serious controversy over if marijuana has medical uses. It has also led to contradictions in laws and classification regarding marijuana. The National Conference of State Legislators explains the current legislations. And on a federal level, marijuana is classed as a substance, Schedule I substance. And that means that it is considered to have a high dependency rate and with no acceptable medical use. So that also makes it a federal offense to distribute. At the state level, things have changed. In 1996, California was the first state to implement a comprehensive medical marijuana program. Since then, 22 other states, the District of Columbia, and Guam have adopted similar comprehensive medical plans. These programs are designed and allow for protection from criminal penalties for medical use, access to marijuana by means of self-growing, dispensaries, or other means such as caregivers. It allows for a variety of strains, and it must allow either smoking or vaporization as a delivery method of plant materials or extracts. Another 11 states have also allowed the use of low THC and high CBD products for medical concerns in limited situations. Now, the issues as far as why there's not FDA approval yet is that according to the National Institute on Drug Abuse, FDI guidelines require that careful studies of very large test groups and the hundreds and thousands are needed in order to accurately assess the benefits and risks associated with a potential medication. And there has not been enough large-scale clinical trials showing that the benefits of the entire plant outweigh the risk. Successful research on specific cannabinoid compounds, namely HTC and CBD, has led to FDA approval of medications containing only these particular compounds. And currently there are 2 medications that contain THC used to treat nausea in patients receiving chemotherapy and in patients with the wasting disease associated with AIDS. and they are Marinol and Sesamet. And the third medication named Sativus is containing equal parts of THC and CBD, is being used in the UK and European countries to treat spastic movements created by MS, and is in the third phase of trials in the US to establish its effectiveness and safety in treating cancer pain. Now to look at some of the actual just kind of pros and cons about how people and what kind of effects that marijuana has. As far as the medical uses that they've been coming up with is that the Institute of Medicine has stated that there's scientific data that there is a potential therapeutic value of cannabinoid drugs, primarily THC, for pain relief, control of nausea and vomiting, and appetite stimulation. It also notes that the psychological effects of cannabinoid, such as anxiety reduction, sedation, and euphoria, can influence their therapeutic value. Research studies found it's also effective in relieving some of the symptoms of HIV and AIDS, cancer, glaucoma, and of course MS. The Institute of Medicine also warns that smoked marijuana, however, is a crude THC delivery system that also delivers harmful substances. That's what leads us to what some of the known health concerns are. An article from Life Science magazine or website, lists impairment of short-term memory, altered judgment, decision making, reduced fine motor coordination, or slowed reaction time. In rare occasions, people can have experienced paranoia or psychosis. Even though smoking marijuana is the preferred delivery method, it has not been linked to lung cancer. And according to the CDC, there is no record of any person dying as a direct result of marijuana use, when it is the sole contributing factor. Make sure you understand that. Not one person has been recorded as dying from using marijuana. Now I consider some of the effects of that with the effects of alcohol and prescription drugs. Health risks involved with alcohol use include liver disease, neurological problems, increased risks of certain cancers, alcohol poisoning. And according to the CDC, around 88,000 Americans die each year due to excessive alcohol use. Half of them were due to chronic alcohol abuse. The other half were acute situations like drunk driving, accidents, and alcohol poisoning. An average of 1,600 deaths each year are due to overdose or alcohol poisoning alone. Health risks of prescription medications that are abused according to the National Institute on Drug Abuse. First, the commonly abused medications include depressants, opiates, and morphine derivatives and stimulants. And the health risks involved with those are you have risk of respiratory distress, low and high blood pressure, unconsciousness or coma, insomnia, seizures, heart attack or stroke, death. According to the CDC, there's 41,502 deaths caused by drug overdoses. 22,114 of them were related to prescription drugs. Once again, there has been 0 deaths accounted for each year for marijuana use. Now, as far as rates of abuse go, according to the National Institute of Alcohol Abuse and Alcoholism, alcohol is the most commonly used addictive substance in the U.S. 1 out of 12 adults, approximately 17.6 million, suffer from alcohol abuse and dependence. More than 15 million people abuse 15 prescription drugs each year, which is more than cocaine, hallucinogens, inhalants, and heroin combined. Marijuana is the most commonly used illicit drug. In 2002, 7.6 million people reported using marijuana on a daily basis or almost daily basis in a survey conducted by the Substance Abuse and Mental Health Services Administration. And an estimated 14 million admitted to smoking at least once last year. Just to sum things up real quick, there's obviously risks with any type of substance you're going to use, marijuana or alcohol, prescribed drugs. But with alcohol, but the one thing is with alcohol, there's no proven evidence at all that there's a medical benefit for it. At least with prescription drugs and marijuana, there is. So you take the risk of what can happen. I'm not expecting for anybody to, drastically change their mind about marijuana because of this. Everybody's entitled to their opinion. But the point is that everybody doesn't agree with drinking alcohol, but it's legal. A lot of people choose not to take prescription medications, but they're still available. My point is that it's increasingly apparent that there is a benefit from it, and we should be able to have access to that. It's not asking to be completely legal. This is only to be for medical uses. You would need to get a prescription for it. And to also get removed from the Schedule 1 substance list so that it will no longer be considered a criminal offense. Thank you.